registered acupuncturist practicing traditional Chinese medicine at YOGAMAMAS. And tonight's webinar will be on how traditional Chinese medicine or TCM acupuncture can help you have a smooth pregnancy and a smooth birth. First, let's start with gratitude. I would like to do a land acknowledgement. I would like to acknowledge the land that we are on, that we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I would also like to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I would also like to thank YOGAMAMAS for organizing, co-hosting this webinar. And I would like to thank you for taking the time for yourself and your baby and for taking your time to be here tonight. Disclaimer, this webinar is for educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your health provider with any questions you may have regarding a medical condition. Please never disregard any professional medical advice or delay in seeking it because of something you have learned on this webinar. First, who am I? My name is Aline Yon. I was born and educated in France. I'm of Chinese and Cambodian descent, and I immigrated to Canada 5 years ago. I hold a bachelor's degree in life sciences from the University of Paris in France. And then afterwards, I went to earn my master's degree in biotechnology management. And after 10 years in the pharmaceutical industry at a global level, I decided to change career. And I went back to school at the Ontario College of Traditional Chinese Medicine in Toronto. And I earned my traditional Chinese medicine acupuncture diploma. I'm now registered with the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario, and I practice traditional Chinese medicine. What will this webinar be about? First, we'll cover what is traditional Chinese medicine, because I guess if you're here tonight, maybe some of you have never had acupuncture at all, but you heard that acupuncture can support you during your pregnancy. That's why you're here. And then we'll look at how traditional Chinese medicine can help you during your pregnancy journey and how is a traditional Chinese medicine acupuncture treatment. First, what is traditional Chinese medicine? Traditional Chinese medicine has a different perspective on health. For instance, when you look at the picture, what would you see? Some of you would see a duck. Here you would see the head of the duck, and then here you would see the eye of the duck, and here you would see the beak of the duck. Some of you would see a rabbit. Here you would still see the head of the rabbit, here the eye of the rabbit, here the nose and the mouth of the rabbit, and here you would see the ears of the rabbit. Does that mean that the people who saw the duck are wrong? No. Does that mean that the people who saw the rabbit are wrong? No. It's just depending on which perspective, on which perspective you look at the rabbit, you would see something different. And it's exactly the same with traditional Chinese medicine and Western biomedicine. They look at the same object, which is the human being, the health of a human being, but they would look at it from different perspective, and they would see different things, but they would still do the same thing, is making sure you are and stay and go back to good health. So how would biomedicine, for instance, and traditional Chinese medicine look at those symptoms? For instance, some of you might have anxiety, insomnia, palpitation, poor memory, fatigue, and have a very pale complexion. So biomedicine would say, if you have anxiety and insomnia, maybe it's the nervous system. So they would send you to the neurologist, for instance. If you have palpitation, they said, oh, it's a circulatory system. So they might send you to the cardiologist. If you have poor memory and fatigue, again, it could be either nervous system, or for fatigue, it could be an endocrine system. So they might send you to an endocrinologist. And if you have pale complexion, they said, oh, maybe it could be a dermatology thing, or maybe you lack of vitamins. So each time you have an issue, they might send you to a different specialist. On the contrary, how would traditional Chinese medicine look at those symptoms? Traditional Chinese medicine doesn't separate your symptoms one by one, but they integrate them. So when they look at all the symptoms, anxiety, insomnia, palpitation, pulmonary, fatigue, pale complexion, they say, oh, it's a pattern in traditional Chinese medicine. It's called heart blood deficiency. So with all the symptoms would be addressed at the same time with traditional Chinese medicine, for instance, in a session of acupuncture. So traditional Chinese medicine is more than 2,200 years old. Why do I say that? It's because the Huangtin Jing, which is also translated as the Yellow Emperor's Classic of Medicine, is a book that summarizes theory and techniques in traditional Chinese medicine, and that book is more than 2,200 years old. And that book is actually classified as by the UNESCO. So it's a very important book. On the contrary, when was modern biomedicine born? Some sources say that it was born on the 19th century with well-known names such as Claude Bernard and Louis Pasteur, who, for instance, worked on microbiology. Some people would say that acupuncture doesn't work because it's more a placebo effect and no research has been done on it. So believe it or not, a lot of research, thousands of years of research actually have been done on it in Asia and even in the Western world. A lot of research have been done on it, and you had also a lot of publications, scientific papers published on it, and they proved that traditional Chinese medicine acupuncture works in fertility, for instance, chronic pain, cancer, depression, insomnia, constipation, and last but not least, pregnancy. So how can traditional Chinese medicine help you during your pregnancy journey? Maybe some of you have heard of the balance of yin and yang in traditional Chinese medicine. So that's what we're trying to achieve in traditional Chinese medicine. We're trying to achieve a balance in your life and in your health. There's another theory that that is very important in traditional Chinese medicine is the 5 elements that you see here on the right-hand side of the screen. So the 5 elements would be water, wood, fire, earth, and metal. So I will go very quickly on the 5-element cycle of life. So in short, water generates wood because you need water for wood to grow. And then wood burns, and when it burns, it generates fire. And then when fire burns, it becomes ashes, and then ashes become the soil, hence the earth. And then in the earth, we find ores of metal. That's why we say that the earth generates metal. And then very, very, very tiny metals, bits of metals are actually ions. And when you put subtypes of iron together, they become water. So you need water to have wood, you need wood to have fire, and you need fire to have earth, you need earth to have metal, and you need metal to have water, and on and on and on. And we need those 5 elements to generate life. If you don't understand the theory, don't worry, that's not important. So how would I look at pregnancy with the lenses of the 5 elements? For instance, when you're pregnant, there's a meridian that you use a lot, which is the water meridian, which is the kidney meridian. It's very different from the kidney organ in Western medicine. So the kidney meridian in traditional Chinese medicine is also what I would call the life meridian. And when you're pregnant, you're making life. So the life meridian is working twice as hard. Once it's working for your life, and second, it's working for baby's life. And when the kidney meridian is starting to be tired, you would have back pain or knee pain. You could have night sweats. You could be either too cold or too hot. Either you would have you have to get up at night to urinate, or you would have to go often to urinate. I have some patients who go as often as once per hour, and that tells me that the kidney meridian, the life meridian, is weak. And if you have swelling on your fingers or on your feet, for instance, it's also because the kidney meridian is starting to be tired. What are other symptoms during pregnancy? You could have, for instance, issues with the spleen meridian. The spleen meridian in traditional Chinese medicine is the meridian in charge of digestion, in charge of nourishment. And just like the kidney meridian, the spleen meridian during pregnancy is working twice as hard, because not only you're nourishing yourself, but you're also nourishing baby. And if the spleen meridian is weak, you would have digestive issues, no appetite, you're tired after eating, you are bloated, you could have some anemia, you could be tired. For the ladies who have hyperemesis gravidarum, you have big nausea and you can't eat anything. And another sign that the spleen meridian is tired is, for instance, when you worry and you keep worrying all over on the same thing, like the hamster wheel, as if you had a hamster wheel in your head. That means that the spleen meridian is weaker. And when the liver meridian, which is the meridian in charge of your emotions and which also acts as your blood reservoirs, is disturbed, then you would be prone to stress. You would be very irritable. You can't handle stress as much. At night, you would have vivid dreams. You would have joint pains, or you could have high blood pressure. And when the fire meridian, which represents the heart meridian, is disturbed, the heart is the emperor of the emotions. So when the emperor of the emotions is disturbed, then you can't sleep. You have insomnia, you have emotional issues, you can't control your emotions and so on, and you could have palpitations. And when the metal meridian, the lung or the large intestine meridians, which are in charge of breathing, your skin or your stools, are disturbed, what do you have? You have shortness of breath. Like after climbing up a few stairs, you're out of breath. You are tired, you have skin issues, you could have acne, or on the contrary, very dry skin, or you could have constipations. And then you could also have other issues during pregnancy that I would say are like outside of the 5 elements, but still covered by traditional Chinese medicine. You could have breech babies, for instance. So breech babies is treated quite well with traditional Chinese medicine and moxibustion. And another condition that people are not very aware of, but where, for instance, I had good success with, would be when, for instance, your doctor, your midwife would say that your baby is a bit smaller for the age, because there's an issue with the placenta or etc. So that's a condition that we could treat with traditional Chinese medicine. And another one, hello, sorry, need to go back, sorry. Sorry, and another one, a condition that I see a lot lately, especially with this pandemic, is I have more and more pregnant patients who have groin pain, or what I would call belt pain, which means it's a pain that are on your groin, and then it encircles you, which means you have groin pain, hip pain, and low back pain, and it encircles you as a belt. So when you have this pain, traditional Chinese medicine helps very well with that. Ooh. So earlier we said that traditional Chinese medicine and Western biomedicine views health differently. They also view pregnancy differently. For instance, all the conditions that I described earlier, nausea, loss of appetite, getting up at night to go to pee, aches and pain, and so on. In Western biomedicine, they said, oh, it's normal. Those are the necessary discomfort of pregnancy. They're okay. You don't have to worry about it. However, even if you don't have to worry about it, there's still impair your everyday life and instill discomfort, which is not nice. On the contrary, how would traditional Chinese medicine look at those pregnancy concerns? First, in traditional Chinese medicine, they said that pregnancy is supposed to be a sacred time, which means it's a sacred time because you're making life. And ideally, during this sacred time, you are like a goddess. You live in a Care Bear world where everybody is nice, everybody is helping you, everybody is beautiful, and you are in a great health. And ideally, during pregnancy, you should be happy and healthy and surrounded by love from inside and out. I remember, for instance, when I was pregnant, I loved it because I was just surrounded by love. I really liked that period of my life. However, to be in this blissful pregnancy, it would be nice if you don't have any health issues. So I know that nowadays, especially with COVID and so on, life happens, there is stress, there's a lot of things. So if you're not in this blissful state of pregnancy, know that traditional Chinese medicine and acupuncture can help you. So we talked about all those issues during pregnancy. So what can acupuncture and traditional Chinese medicine help you? For instance, if you have groin pain and belt pain, with acupuncture, we can relieve the groin and the belt pain, and then you won't have those pain, which are sometimes excruciating, that would wake you up at night. So you would have better sleep. If you have a breech or small foetid baby, for instance, with moxibustions and acupuncture, we could help turn the baby. Usually it's from week 34 until sometimes up to delivery. We could also help the baby's growth, so the baby would have bigger weight. And if you are stressed out, irritable, you can't sleep because you have very vivid dream, you have pain everywhere in your body, and you have high blood pressure, traditional Chinese medicine acupuncture can help you and soothe your stress and emotions, and it would get you back into a peaceful sleep. It would relieve your pain, and it would help lower your blood pressure. And if you have insomnia or emotional issues and palpitation, for instance, we would help you with better sleep, so you would be also at a calmer in your everyday life, and you would have your heart at peace. And if you have digestive issues, fatigue, anemia, no appetite, and nausea, would help you to have a better appetite, digestion, stop the nausea, and so you would have more energy. And if you have shortness of breath, will help you to have a better breathing, will help you have more energy, will help you to have a better skin and smoother stools, because I know that constipation and hemorrhoids can be a pain during pregnancy. And last but not least, if you have knee and back pain, because those are considered, for instance, normal in pregnancy, especially at the end of the pregnancy, traditional Chinese medicine and acupuncture can help you and relieve your back pain, your knee pain, stop your night sweat so you would sleep better. You wouldn't be too hot or too cold, would help stop the night urination, would decrease the swelling, and then you would have more energy. And if you look at it, there's an answer that comes a lot is more energy. Why is it important for you to have more energy? Because you need a lot of energy to deliver a baby. And you need a lot of energy to give birth, but also to recover from giving birth, because then some of you decides to breastfeed the baby, so they also need a lot of the energy to make milk. And we need a lot of energy to give birth and recover from birth, whether it's vaginal birth, but also a C-section, because you need a lot of energy to recover from a C-section. So we talked earlier about how acupuncture can help you during your pregnancy concerns. But how can acupuncture help you with delivery? So in traditional Chinese medicine, we have what we call labor preparation. And the goal of the labor preparation is to help you have a smoother and hopefully shorter and less painful delivery, especially if it's the first baby, because usually first baby, it's longer delivery for a mom. And how do we do that with acupuncture and traditional Chinese medicine? Well, the needles on different acupuncture points would help loosen your muscles. So when your hip muscles are more loosened, then the hip bones can open up more easily. And if they can open up more easily, then there's more space for the baby to be born. And we would also help ripen the cervix, because you might have heard of it. The cervix needs to be ripened for the labor to start. We'd also give you more energy, because you need a lot of energy to give birth. Some contractions could be erratic, so acupuncture can help you with setting up like more regular contractions, and also help descend the baby and optimize the baby's positioning. For instance, you have babies who are head down, and sometimes they're in the right position, and then just a few days before birth, the midwife discovered, oh, the position is starting to be anterior. So then with the needles, we can help positioning the baby back in the most optimal position. And when we would do labor preparation, so we will start from week 36 of your pregnancy, and ideally you would do it once a week until delivery. And once you're past your due date, ideally you would have acupuncture sessions every 2 days or even every day, depending on how long your doctor or your midwife is willing to wait. And of course, we also give you tips and acupressure points to massage to help you with encouraging the baby to grace us from their presence in this world. There's also another point that I would like to talk about in traditional Chinese medicine. It's a point that is nicknamed the beautiful baby point in acupuncture. So that point is on the leg, and the Chinese name is Pin, and it's translating as guest house, because in traditional Chinese medicine, they said that when you're pregnant, your baby is a guest in your body. And they usually needle this point on the kidney meridian, the life meridian, at the end of the third month and the end of the 6th month. So you would transition, you and your baby will transition well between trimesters. And why is it called a beautiful baby point? Because in traditional Chinese medicine, they said that when your baby is healthy, it will be beautiful. And some sources say that the goal of this point is preventing any in utero disease that could be passed on the babies. And so therefore the baby would be healthy, and a healthy baby would be beautiful, hence the beautiful baby point. So how is traditional acupuncture treatment? Now that you know that traditional Chinese medicine acupuncture can help you during your pregnancy, how is a session? First, some of you have never had acupuncture, and having the idea of having needles in your body as if you were a porcupine or hedgehog can be a bit daunting. First, know that traditional Chinese medicine acupuncture is pain-free. The needle we use are very thin. They're single-use sterile needles, and as you can see in this picture, more than 10 acupuncture needles can fit in the hypodermic needles. In other words, you have more than 10 acupuncture needles. They are so thin that they can fit in the needle that is used to draw blood for your blood test, for instance. So it's very, very thin. So normally when on needle insertion, either you feel a prick like a mosquito bite, or either you don't feel anything. And then afterwards, either you could have like a tingling, achy sensation, a traveling sensation, or warmth, or no sensation. We just feel relaxed. But it shouldn't be painful. It shouldn't be sharp stabbing, because the idea is once you have those acupuncture needles in, you are able to relax and sometimes fall asleep. I even have patients, the first day they come and see me, they're very anxious because they never had acupuncture before. And then afterwards, when they come, they go on the treatment tables and it's like they're ready for the nap. And the only thing missing is a teddy bear. So it says that acupuncture should really be pain-free and help you relax. So what does traditional Chinese medicine acupuncture treatment looks like? First, we'll do a holistic health history. So I will ask you about your physical body, if you have any pain anywhere else, discomfort, and so on. I will also ask you about your emotions, if you are at peace, if your emotion goes up and down like a roller coaster, or if you're more sad or angry and so on, because those would tell me things about your health. Because in traditional Chinese medicine, we do not separate the body and the emotions. We really look at you as a whole person. Excuse me, I need to drink. I would also look at your lifestyle, what time you go to bed, what time you get up, what's your work, and so on. If you have a stressful job, or if you're working at night. I would look at your diet. And last but not least, I would look at your pulse and tongue. In traditional Chinese medicine, I think it's the only time when sticking out your tongue is not a rude thing to do, and on the contrary, it's welcome. And then I would look at your pulse on your wrist, just like on this picture here. And then once I have a thorough health history, then there will be treatment. So as I said, it's acupuncture, very thin needles and very few needles because you're pregnant. But there could also be other treatments like moxibustion is burning near you, not on you, dried mugwort, so you would have a nice warming sensation on your body. It's very effective for breech babies, for instance. Sometimes you could have gua sha, maybe cupping. Also cupping, I haven't done much cupping on pregnant patients. You would also have lifestyle and diet advice. Sometimes you could have tuina. Sometimes Chinese herbs, although during pregnancy, we usually avoid prescribing Chinese herbs. And last but not least, once the needles are in for 15 to 20 minutes, I would step out of the room, dim the lights, and you will be able to relax and rest with soothing music. And sometimes some of my patients even fall asleep during the treatment. And when would you have your acupuncture treatment? I would say you should consult as needed, and either whenever you need, whenever you have discomfort, when you have a small 4-day baby and you're worried that you or your doctor, your midwife are worried that the baby is too small, so we could help with bringing more blood flow to the baby so the baby would grow more. If you have a breech baby, at the end of the first or the second trimesters, at the end of the 3rd month or the 6th month for the beautiful baby points, and also for labor prep from week 36. How often would you have acupuncture? You would have once or twice a week as needed, again, until your issue is resolved. And usually it's once a week. And once you pass your date, it would be every 2 days. And how long would you have how many sessions you need? Again, it depends on your concern. And for labor prep, for instance, it's until delivery. Bonus to keep you healthy and happy. Some of you might want to do some gentle exercise and meditation and stretching with YOGAMAMAS, which offers yoga sessions for pregnant ladies. Now it's open in person, so you can have in-person classes, but if you prefer, you could also have on-demand online classes on yogaMamasOnDemand.tv. And for a few days, until the 31st of this month, by using this code FTBALI, you can enjoy 1 month free. So please feel free to take a picture of this slide so you can enjoy 1 month free of on-demand yoga classes if you feel like it. And pregnancy is not all, because when you're pregnant, at some point, you will deliver a beautiful baby. And so I would also like to invite you at the end of your pregnancy on the 8th or 9th month, for instance, to prepare for the delivery. to the arrival of baby and for your postpartum period, because postpartum period is very important in the life of a woman and also a mother. And that would also prevent postpartum depression, for instance. So I did a webinar on how traditional Chinese medicine acupuncture can support you in your recovery and bonding with baby postpartum. So you have here the link on YouTube. So again, feel free to take a picture of this slide to have all the information. And if not, you can just Google my name, Aline Yon, on YouTube. I have a YouTube channel with the replays of my webinars, including this one. Thank you for your attention. Thank you for being here. So again, my name is Aline Yon. I'm a registered traditional acupuncturist. I practice at YOGAMAMAS on Tuesday and Saturdays. You can call here or go onto the website if you want to make an appointment with me. But also know that at YOGAMAMAS, there's actually an acupuncturist every single day, 7 days a week, that you can see. So if you can't come on Tuesday and Saturday, that's okay. We have great colleagues. We have Teresa and Ingrid, who are also great acupuncturists. So you could also meet them, and they would also support you during your pregnancy and also, but also during your postpartum period. And if you have friends or family who have fertility challenges or just want to optimize their fertility so they can get pregnant and have babies, know that we can also help you.